word. No long thing, or Lord, I need your help. No one else.
Demons tremble at your voice. Mountains move when you roar. The dead will rise when you speak life. Wasam yenkwa. Every other voice, so yeah. It's an opinion, they can have it. Eradikaso kasa. Now what do you hate me? Demons tremble at your voice. Move when you roar. The dead will rise when you speak life.
I'm on live now.
Every other voice, so yeah. Hey, it's an opinion, they can have it. Eradikaso kasa. Now what do you wasam yesusumo. Onyame wasam yenkwa. Wasam yesusumo. Onyame wasam yenkwa. Wasam. Hey, wasam yesusumo. Onyame wasam yenkwa. Wasam yesusumo. Onyame wasam yenkwa. Wasam yesusumo. Onyame wasam yenkwa. Hey, wasam yesusumo. Onyame wasam yenkwa. Asam no yaba. Kebe asam no yaba. Asam no yaba.
Esieni kejanya sida. I refer woni pa ho. So da me pa ya ne se. Me remfi papa wa ya me. Esieni kejanya sida o. I refer woni pa ho. Ade ba ko na me so ne se. Me remfi papa wa ya me. Low beat go. I say me pon kompo ko hwemechi. Baby I'm free ni baby I'm free. Or therefore, why na wo betumi aye we. Na say me susu kuso sese. Stand back and take account. Or therefore, wait there, it had to be you. Na say me boom kompo ko hwemechi. Baby I'm free ni baby I'm free. Or therefore, why na wo betumi aye we. Na say me susu kuso sese. Stand back and take account. Or therefore, wait there, it had to be you. Enti, why you be oh? Why you be oh? I de throw a salute yeah. Why you be oh? Money oh, money oh. Eja mi tu chama oh, money oh. Why you be oh? Why you be oh? I de throw a salute yeah. Why you be oh? Money oh, money oh. Eja mi tu chama oh, money oh. I was nobody, you've made me somebody. I de throw a salute yeah, money oh. Na mi nyopia, eradia ye nyopio. Yesu mo, eja mi tu chama oh, money oh. And I gain money oh. Money, money, I de throw a salute, yeah, money, what money be money, 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 eh. I jam it to chama, money, look big boss and kuno, money, 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 eh.
Good evening, good evening, good evening, good evening.
Good evening.
So where is our where is our lovely host?
He's here.
The one and only.
Oh, we are one.
We are one. Take it over.
Hello, everybody. Yo, adofo. Mr. Principal, what done ya mammy dear Bamba, chobit me my and one bit me repeat sign me my viewer. So, Namo share. Namo share link, you know. But I won't share link, you know, and then I mammy walk 1 minute my share link.
You see any Kenyan yesterday? I refer nipa home. I dear back on a mystery and say, me ready for papa, why am I low? Beat, go. I say me boom come pop, baby, I'm free in the baby, I'm a dream. Or therefore, why now bet to me, I away. Now say me so say, stand back and take account. Or therefore, wait there, it had to.
I won't share links in my me.
Now say me boom come pop, baby, I'm free in the baby, I'm a dream. Or therefore, why now bet to me, I away. Now say me so say, stand back and take account. Or therefore, wait there, it had to be you. Enti, why you be oh? Why you be oh? I de throw a salute, yeah. Why you be oh? Money oh, money oh. Eja me tu chama oh, money oh. Why you be oh? Why you be oh? I de throw a salute, yeah. Why you be oh? Money oh, money oh. Eja me tu chama oh, money oh. I was nobody, you've made me somebody. I de throw a salute, yeah, money oh.
Hello, adofo. Me mo bibia kwa ba. Me mo bibia atnasie. Eye radia dom enene nso wa me aba behiem wa ha. Eye adom no ka yense bi. Abra COVID ebo yen ba efom ba ku mienu yesum benkum ni nifa. Waboa yen abo yen ho ban sonko ama yen soso. Se yakan ya kate asefo ho a na si edi kan di aseda. Emo twedi ampo nyankopon so abo yen ho ban sa. Yetusu mienu me fans. And now opepon bosume eda etusu aduonu mienu January 22nd 2021. Minya video bia ma out. Me fans nanso mo teste mo me encouragement mo di nsem bebre me advice decisions because me di so bebre efise mo ni wa me ni ho enya me chade makwa kofa akukuda mo omo akostu adru anim ye a omo nim yare aya to renkyem a apabeda eye ewiase na meme atwe adwea kɔ bibi so ne abu kompo akwakohwe yechi enuma eto ye no sese yebu kompo kokohwe yechi a ti yebu kompo akwakohwe yechi me ye sure pa say 31st night 2019 New Year's resolution be say 2020 die eniama abaye no enya senketewa me chidi ye pa so wa na nwi da ese COVID ebeba ye beya atorencham ato wiase nyina ekunipa a egusu ko nenim ama sese kwa de yesi new variant aba enokra no spread passne kanedie no yant na ho ema enkoso na enkuyen evisa bribia no marginalized population na yesi ekuyen ya mane ma metoyore ase nyamencha de yan Ghana for rade aboy ho ban sunku bebre ama owo ne so ewo fom ya before the enso wo fom ya ntwen mane nkosoro ansana ya hweyie enti ya ba bebon komo ya de nyum ba ko betwam na ansana ya de nyum no betwam no ye medical aka ne se magima konyan ma bomodi ama pe hot water any tea na me de lemon agum enti mpacho wo so fadwa na je bia nso hye aja COVID any cold season dey so hye ne lemon na ye ne dia build the immune system no ne wash ye nsa so enso hye enti de nyum ba ko se atwamu na yɛba ama yɛ introduction na yɛatoa so.
Break up. Still no break up. Only God. Yeah. Aye. And you there. And you there. And you there. And you no. That's right.
Highly spiritual.
And rain you mere. Shia Yeshua HaMashiach says it's coming down today to perform a miracle for you and I. Namizaya me atamnana. Senka me bonia shamema. Very far from the mercy, but you give him the opportunity to worship your majesty, to eternity, to the Holy Trinity. Angels are singing, seraphim and cherubim. Okoto, nenya me atamnana. Mesuma kutunibyo, me boni dindo. Namakase, igwe na mesasido. Maya tuwa, igwe na mesaside. Igwe na mesasida. Enyano. Igwe na mesaside. Become host above.
The follow mo share my Facebook page.
Coming down today. Senjene neze. Senkuba for dinechi. The dinsu dinenim. Unbreakable. Dinenim. Tie. Na e grandma no zuru suakasa. Obombarani. Dishenya mi animonyam. Angels are singing. Seraphim and cherubim. Okoto, nenya me atamana. Nesu makutuni bio, meboni dia chiramano yamye. Igwe nyamesasida, also na yamchusa. Igwe nyamesasido. Igwe nyamesasido. Yeshua HaMashiach. Igwe nyamesasido.
Yo adofo ye da mase ye twa ye ho aba na se de meka me ye hye so afa won so hye na oba betena ase ne abonkomo efa covid-19 ehun ansa na meye introduction no me sama srade back bio me sra se wo be hye video no de ama wonua bi ana be hye no wo page na ye tietie na yetimi akora ehun yie na ye nsoso afisese no ni ekase yenso yeguso kate asefo ho na covid etu atwa anase covid anu abrase yo ni edikan ni ame introduce no na edikan ye fra no Dr. Janet Prantin Esare. Dr. Janet Prantin Esare eye adwuma wo U.S.A Memorial Hospital aiwo Worcester, Massachusetts. Wadori yie pa wo enro emamu enti enne obekire yen eniema eye enro so nsunsuanso abra covid ato atose ni otoso bio nsoso ye friend Dr. Rose Kranzia Seme. Dr. Rose Kranzia Seme eye professor wo Feedback State University enti mo say oye educator enti onim Enyemamu ye pa ono ni bibia no is based on evidence. If it's a message or so evidence based. Until all the time no evidence based practice no based in the bibia. Or so ye supervisor Emerson Hospital. Emerson Hospital. Ono so ye better than kana oni atwetwe komo. Me to aso. Nyamencha the platform ni aye ne dia eye me penny eye SKF ejanya ono anka na ye nhiem wa ha ono na waye no wakekan ya bom no ama e platform susu sei ese ya famra me metwetwe nkomo ono susu ka ho odi contribution ebeba eja covid obia has a story obia wasem obi kan ne dia obeto dia fanyinam ene ye beye asum ye beti ensem ne de bia to ye hofo ne aboye ho ban ne a kire bi nso Miria nakamia me Prince Paul DJ one and only and then there will be the whole world Prince Paul Otiso and you know that okay pon okapa na ne ho wasan so DJ amaye enti Prince Paul eka ye ho bima obi bia akwa ababio Dr. Rose Dr. Janet SKF and a Prince Paul me mama kwaba
Yeah.
Dr. Rose
and then the other computer is in grid view. It's the same exact meeting.
Dr. Rose.
Yes, ma'am.
Yo, me the best start also.
Okay.
Yaka COVID asama COVID-19. Say it's a new strain and a new variant kra aba. At West South Africa any UK. COVID-19 yaka ho asem almost 1 year ni kwa na ekosro. Kwa na eku nipa. Pepa cho betimi aka ho asem kakra na ya to anko twetwe so.
Yeah, okay. Madam Wasi, Bedre, say, Mama, me opportunity. Into Obi, me for a lawyer because when him say she is not my language, but never more than. Into Ibia na wabuame. Into COVID-19 day, ye na yati COVID-19. COVID-19 affect you long. It's a respiratory disease. Into respiratory disease, no, when you yare na it goes through the respiratory system, then it will go and live or now long. Into say call long nima na start ADD. Into ADD longer when him say a nipa no nia yen kwan ye wo no home a yitumi home. Na home no so yitumi home no exchange no it take place where your lungs name. Inti say yade no call wohinum na say e fam na ekoda wo lungs na. E didi lungs na e bedroom ebe na wontumi enhome. Inti na ema yare na yehu ni say ye nyina no say yare na etumi ka obia. So wo yare, so wo ni yare we yakola we penny e ka obia. But say e kan wo so a so nipa bia ne senia yare de kanwa how long a bit take care obet me I manifest symptoms into obi or why onya yare na enche be na nsa be nanai na wa start symptoms into symptoms no ebi ni eden symptoms no ebi ni so obi or why wuti be pa wo ho be ye hye wo ready mu ina ebe bubu ebinum tumi ebowa ebinum tumi nya diarrhea inti different the brain inti ne man ye hu ni se e kan wa ansa wo be symptoms no wonnim sa kan inti no wo betumi e de asan crofo bebre inti eno na ema no hu because ba ni sa by the time e be kan nipa na to ho no na ache inti ema yade no ne hu yi inti no say unya any symptoms to say bibia wa I to say a flu but ne kesim into a bibi to say home fa want to mean sorry home bubu na neoma bisa na was a wabo modern ape baby akoye testing into yade no yade a can lungs very infectious very contagious into no na COVID-19 into just say yade na a virus na so no no SARS COVID-2 inti eda omo be year omo be hunu no omo de ato ne di inti no omo hunu 19 inti na friend COVID-19 inti this is a kakra metimi aka fa COVID no but nyoma bebre wo COVID ho still ayeni ayegu so esua inti da bia bibi foforo betimi aba ena obi a de be betimi ay different from nipa foforo so be inti
Yo, Dr. Rose, and that's it. We are doing what much tree na me at here. I say COVID-19 affected your lungs, and I say respiratory disease, your humie, yarium and fire and from my humim, and also soon a money deadly because ya humia a cranning in ano, and quite a cranning in a humie, enemy you create crown. Edasi. Dr. Janet, mpacho be probe di biba kan won na fe wi a ye di at platform na ye discuss.
Yo, where before I me di biba kan ho no, I just me person me kan bibi kakra na yeah, you know, the reason why you program yi very yeah say the person you educate in public, Worcester community. It's and with the help of SKF, you put to program it together. So the your community your woman you be benefiting from nyame ayi kakra odi amaya you betimi a share na ye nyina ya timi anya apomudin enti efri enabu ekona ohwa ye be keka niema ebe ma ya pomudin akoyie na at the same time so what question bia wo inbox so na ye bibia na yetimi aboa a resolve said ebe ya ye betimi atumpo wa hoodin mu sanso na ye be koso akase say ye be ye program yi about health especially say do health section it will not replace your medical advice from your doctor because program here a general obia were individual specific unique illness bia doctor no determine based on their labs and everything. And he say yeah program in a health section now is general say but it doesn't replace what your PCP and I say your doctor will tell you to. And this is just a little become. All right, so this is that kind of very good. Say or cancer, COVID, respiratory illness. It's true, it's respiratory illness. Or cancer here, you have two needing COVID-19. I want to just say a little bit about mode of transmission. Say, you say so many people, especially America, have over 24 million confirmed cases now. It won't over 400,000. The main reason it transmits social say you better cluster your home together. Social distancing your home. Nah, indoors gathering, more people gathering together. Say back to us I say no cause that person may be a carrier or asymptomatic or unsure symptoms be now virus new anymore. Into who's on you're very healthy or now I call chale okasa because you may not know say this person has it. And I didn't see a droplet. You can see droplets is in sneeze bowa kasa yes you Ghana for your kasa say kasa because as a kasa ni nyamrofo de na sho ye de kasa jeti you kasa ni na just say kowiem na spread it into sa droplet and I'm more about to say because as I say if I have it I'm talking it will drop on the surfaces until no me feel no be so the inside can akokan insa or the bekanim kanani kanahene na eno so no akonya na akokan e call mususu a go into your mucous membrane and then it starts to find a way through your lungs. That's the way of transmission. Kakra meka afahun. Until more discussion will come along. I have so many, but as we go along, no, it will come on board.
Yo, marginalized population, but where they come in na na yare no yakase eku omododo before yan minority no yan yesi yare no eku yen dodo do wo ka cluster say a contribute to it na wo hwa e dia party through intimate me ku yen dodo.
Okay, idea teacher it's me equien edodonos and it's a menka something about the marginalized you use the word marginalized and somewhere so we call it healthcare inequity or disparage in healthcare. I didn't know we have disparage in healthcare. There are so many factors that contribute to that. because how do you call it? Yeah, before. Our descent, because most of us, it's not a time to, most of us know, me papa na me papa or hypertension or Ghana. So no be so diabetes. We have most of the underlying diseases, no. Yeah, will be. And aside from the underlying disease, no, we suffer discrimination. There's healthcare discrimination. Because maybe I will call doctor or doctor can say, oh, okay, within a pie will say, remember out of faculty. Meanwhile, so maybe I'll bring you so many other stuff. It is just the inequity in healthcare, number one. And the other thing is the access to healthcare. Yes, to be brave, I am hospital. Be brave, Juma, or more healthcare, or more insurance. So on area, on conco doctor. Into by the time yare no ebe count no beko ko doctor no na yeding aye too late. The other stuff that comes in is say yejuma most of us no yejuma in healthcare. School corner baby ayako school kodun into we're doing the menial jobs. Into no those kind of things doesn't even give us the equity na yare anymore. The other thing is a housing baby ayete. Especially the minorities, there's not good ventilation in the house. Into senipa ba kofa ba fi ho a na ye che e de ama abusiafo no. Into no ebasa into affecting this population affecting because of nyoma kakra makaka. Into no that doesn't mean say wo yare a enkonko hunu doctor. I was say your boy home modin. I was say yes, sorry, yes, sure, and so ye. Oh, I was say like we have to defend our can begin. I would say the lemonade and there to improve our immunity. We have to working on our immunity, working on our health. And that way we'll be able to fight diseases when it comes to us. And see, the disparity is there, but there is more for us to do to get over it.
Doctor, thank you. And some for Becca yes, okay, some disparity, and also so can be into Obinia or Phyllis or Yari COVID Nicra or best friend doctor no. Na and say be cocra, yen permission, be mammy Tylon no be intimate nephew. Obi so Becca say, me quam so cry, I see Yari and no cocoa or more. If he hospital back. I dear some now bet me a catch rum say, my when it comes to COVID necessary respiratory no. My fat anya mano and she it na yen seeking help immediately.
Yeah. When it comes to COVID, no cry, it's not only about your doctor. So a hospital na you can say stay away from hospital. But who are primary health physician, who bet to me afro, who bet to me alcohol. And yes, I cry, there is so many places you can go. You can call your health there's so many places. Massachusetts, we call mass.gov. There are so many testing areas that you can just walk in and get tested. And maybe not a Worcester Ma free testing. Gardner free testing. If you're not feeling well, your doctor's office, it's fine. You should call them. Or more appointment, or more time, no work, because they're not taking everybody at that time. But we have, I would say, persist. Read him enter into was a na woko into woko back on us that doesn't mean so was what's a fee. I was so who doctor and answer the community. We have many clinics, we have places that you can go and get tested.
Dr. Janet.
Yes.
Yani can't be say young building immunity. So immunity no eboa ye pa no prevent COVID and I say ye bibi so can.
Well, that's it. Yes, can say immunity. Any part of the new or how been a kind your co school in India be doctor being a cancer or say eat your food as medicine. Otherwise, you eat medicine as food. The whole thing is if there's any power or you have to eat that food as if you say would you draw. Meaning, if I plater, it should be different colors. You can see who build immunity. Adriane, fruit and vegetables. You know, and yes, said you ain't gonna for your pay. Say banku fufu abem and number koda so. As I go obedidia, what for greens with like balanced diet. Ufa the way kanka nuts, fruit, berries especially. Those berries build immune system. Until you do when we na dealing they build your immune system. Won't train. Oh, now the immune system no say okay, body in the well body in the ASM. The body is there. It was not yare be by the invade body ni more. It is germs that COVID be invade body more. Now I attach I invade body ni more. Now I multiply. So a multiplier. Now I may infection. Now so infection no. And now the body is relying on the blood cells no to fight that infection. Your blood cell, you were two, your red blood, and then your white blood cell, which is also called immune cell. So our red blood cell, then they carry your oxygen to your organs and your tissues. And you what the white blood cell, which is the one there, and you may have born to say the ever fighting infection. And it's our virus, no by the invade your system anymore. So our blood cell, they are different types. White blood cells, they are different types because we come different heavy names. So it is our germs no come now when you're infection. I ever yarn. Now, sir, white blood cell not static. Your munuma, if you be engulf, if you be ever capture, dear no. Now have another cell no abba. Now pieces of that, let's say COVID virus, no pieces now left you over, no. Now another cell now about different antigen, something I don't want to go into details with science here. Now I know about attacking no. And no they are that white blood cell no status antibodies now about attacking antigen, no. If you are attacking now another white blood cell no so T something no and also so attacking cells now, invader no about attacking, and then also getting rid of that cell. All this is your body fighting. No, it is a yes, I know. Yeah, now a body no, a overcome no. This is your body. Now that white cell no needs support to make it stronger. And what we have to do no is to support our body to help that white cells no to fight it. That's our immune system. No? And what we have to do is the fruits and vegetables. And then nipa be all the time I keep saying, every day be nipa here some certain amount of nutrients in our body. We don't get it from food, no matter what. You can't get it all from food. And you take multivitamin. So multivitamin, no, they have something called daily allowance of nutrient. Everything from vitamin A all the way is in there. So you take that will help your immune, like have you get your daily allowance of nutrients. Now a fight inflammation and I say that virus or a disease or bacteria that will invade your body. And it is good all the time to work on your system by eating a balanced diet and then getting more rest, water, all that will help that immune system build up better.
Yeah, can be bisa before yeah, now mainly no, you place in a cluster environment like a nipe wo fie no ratio no to a fie no as a room palami no ni dem nkofo fie oson ye de bia rent apartments so our roommate the na Dr. Rose ka say yes I den say ye be hwe ye ho yi Osha. So you bet me you will fear, you bet me I encourage you and can mask no. Abribia no kian share. And now say who fear the out trust on kakra. Unya real, un testy positive. Again, I bet me a kaka boy.
Oh, say who fear. Now what we immediate family are, you don't need to wear mask. If you have your immediate family, because sure, who call now by insider. Say virus no would be remwa, and some will be show symptoms. No more of and so there's no need to wear mask when you are in house. But so who be outside that person or you guys, everybody wear mask because only back now, but that person may be asymptomatic. Only symptoms be an or bamumu. But immediate family within the house, no, you don't need to. But what you have to do is say, this is winter ya or what you open your windows, let some air come in, ventilation, or be a window kakra, why you fan be or how blow kakra, you know, not a ventilation, but you don't need mask when you are within your, you know, surrounding family, immediate family.
And okay, some nutrients, beyond your benya daily allowance. No, Obetimia can elaborate on whom more my if you say, your castle, your region jam, building immune system, kutu, and as a citrus and so bois. But send your kind and near maybe or why, maybe as some kind zinc, in reality, why yen free. No, your doctorate will room, no bet me a cajon some year at train, send you bet me a building immune system in you.
Okay, so everybody can said the best way to go is a multivitamin once a day, which has that, you know, daily amount, not too much. After any extra EBR will be determined by your doctor based on your lab, say your lab level is lower. But yeah, you want your chromono when you say to move for your boy your skin say area vitamin D #1. Now your back area we get vitamin D from sunlight. But your back area and moyen. Into you end to move for you like vitamin D. And no crying until I'm one of the number can about marginal for vitamin D, black people says no more be steady. Be I think Boston, one of the hospitals, almost try some vitamin D. I say if it correlates with COVID. But still, science they know said lack of some nutrients. And it may affect a severe illness. But then it's still having proven there's still clinical trial going on. But yes, it is linked to it. Because most of the people know munyano, but they see that they lack vitamin D. And number one, the nutrient background, you have to work on the vitamin D. And he said, who far with daily allowance of daily vitamin, every amount the body need in a day for the cell to function well is in there. But then extra, and who say a prescribable vitamin D 50,000 units. That means you are very low. The amount of 50,000 be once a week or once every 2 weeks or once a month, depending on your level. And moreover, what else do we need? Vitamin C, calcium, iron, all of these things, with annual visitor, they do your blood work, they see that you are lacking something. But as I continue to say, multivitamin will not go wrong. It can't overthrow you, but who are not gonna say, I feel say me zinc echo from and as me feel say me iron cough from to me cough. No, I won't advise you that because you can get some other form of anemia, of course, and a low iron or a high megaloblastic anemia. You don't want that until you stick with your daily vitamin. But with fruits and vegetables and your daily vitamin, you can never go wrong with that. The ginger you mentioned, because I used to have a lot of questions. COVID by share concussion na sobolo, printia, pepper, wine. These things cause bleeding. Okay, as I said earlier, I said you eat your medicine as food. You eat food as medicine. What for Wedro? Ginger is good for inflammation. It's good for the body. Garlic is good. Sobolo is good. Eat it as food. Unko share. Now you are affecting your kidney. In the meantime, COVID invade your body. It attacks your organ. Some people have gone through COVID. They are in rehab. Some people have gone through COVID. They have had heart attack. They have had pulmonary embolism. People are going through kidney failure. So Do you know which pathway of your body that is going through, kidney or liver? You don't want that. All you have to do to protect yourself, maintain a balanced diet, sleep well, hydrate yourself, exercise. You should be good to go. COVID, it will affect you, but if you maintain a very good, healthy, system is working. So the germs come in every day, but with a good immune system, our lymphocytes almost fight you. So all I can say is the ginger is good. Don't overdo it. The garlic is good. Don't overdo it. It will cause bleeding. Garlic causes bleeding. And maybe I talk about so many herbs, what it does to the system, and what is baby also interact with other medications. So I saw Boloya Abasui. Interact with so many medications. You can have it as a little drink, as Adia Petty said, when you're orange juice, you can have it like that. But mixing it up, not beauty, asan and kajari, asan bono. Do you know what kind of chemical reaction is going on in there? Just maintain a healthy diet and take your vitamins, and I think it should be fine.
Thank you, Dr. Janet Kranti-Asare. Who can point be a very, very interesting. Sa nearman aden yendi ne say ye dear Gianni. Dan see a becky campo maya concoction. And now cano a dorsum into we don't know the reaction. Sounds so the quay mososwa, we don't know the reaction. Blacks do medications so. And now can say the mechanism might interact with it. That's a very good point. Dr. Rose, bet me a kabia kamania to us all.
Doctor can be about immunity. Minka bibi kakra about how to help ourselves, how to prevent. Doctor can be brave. Dr. Fauci Becker, our mask, right? You said something about the cluster. Around this time, no, COVID, no, it is real. Party. Na ye ko na ye ba na ye chia na ye hagi na ye ko obi o ha mask ne da ne ha, right? It's not helping anybody. When we talk about cluster, modern, stay home. If you don't have to go anywhere, stay home, right? If you build immune system, to say Dr. Janet can't be brave. Yenti 5 vitamin, ye share who see ye. So be pia no what's nefi. Why? So if you're not feeling well, not what seek help. No wakwa at the cry you. Mama share who see Nyame adom nioma ebeko yi. We mu nyina no eto betwa. Ye betumi, once we get back to normal, we'll be able to do all those things. But for now, no. Nyame ahwe enso amaye bedru afia. Mama ye momodin ye avoid all these clusters. We cause it ourselves, no. And they say, minimum way, only be, all bad wonim so your career. Into the Modiana, yen share who see na yen shed mask so in here pa. That's the only way a baby when you're going out, quite juma, call a baby. But no, hurry and sasso, hurry and sound come every 20, wash your hands for 20 seconds. Into baby, I will quite only say a populated new try and avoid it. Not in a fee. I will also maintain the social distancing, 6 feet. Try your best.
Yeah, that's it. Yes, Dr. Fauci, I emphasize the brave mask a use of. If he say, and I'm God being so good, President Biden, Eddie Abbas, we are doing 100 days challenge for mask. It's young try see a mask, a bewa yahu, a bribia. And now let me tell Dr. Fauci. Now I'll say new strainer is in UK and South African. Or say no dear, it's spread so quick.
And Brazil.
And into Gusoko and Brazil to 3 places. Now you was baby so and yes, spread a big cross to what Baba do a U.S. has. It's no strain because what say say yare ne koswa. You benya more cases. You benya more remission. You benya more cases. Na hospital akoswa ye ma. The hospital ye ma. Care be to say oh ebi obi enya heart attack. Oh ebi obi sugar go ekosro. Na esesi ye ration ne de kono. Omo nya chance. Enti ebema owu nso so akosro. Enti yanya ya afamu die kakra. Say you 100 days challenge. Yes, yare be kosoro. Nyame chade vaccine aba. Yes, nitrate so nitrate oxide so I actually is under more research. I have the spray minimum and so almost say is proving say a bay. It is any kind of with time. Say you na ya famu dia. And che you na be ye. Ama yare kwa ye to not sekura. It does be brave. Principal, but you better 1 minute to us because here were 10 minutes pay.
Sure.
You are the four. The Cecilia now join Yeshiamu Ewo Zoom SKF Media. Na yedi apomuden asem eba. Send Dr. Janet Kayeno, ya create say ye health talk. Na yedi aboa ye hu abra COVID-19 koso adane ne ho aba different form. Ayese no de spread cross ne. Eye 19 no. I see South Africa, I see UK, I see Brazil, ebi aba United States. Ɛdeɛ ne yɛbɛyɛ ne sɛ yɛbɛbɔ yɛn ho ban, ne yɛtwitwe nkɔmmɔ na yɛakyerɛkyerɛ yɛn ho. Wowɔ comment bi a wobɛtumi atype question bi wode ba a yɛbɛ answer ama wo. Yɛtoa so. Dr. Janet.
Yes. Yes.
Me sami wɔ wo so bio.
Oh, no problem.
New variant number, Dr. Fauci said spread pa na asa yen so ano. Nti ese ekoso na ye build the immunity, ye wash your hands, ye didi ye. Healthcare workers so mo do so hapa ye. Wo ko beba no wabre, ade chen ese wo san ko. Wo beba no wabre wo hwe nkwala, family matters. Dear na wo hwa yebetimi di aboa ama healthcare workers so omo ho ato omo kakra na say easy omo problem kakra.
Sir, in terms of
Or breast, I'm immune system from.
Oh, okay. So it's the same thing that I said, like a vitamin. Me for one, I can share what I do. There's a friend elderberry. Elderberry is kind of like echinacea, something like that. Very good for immune system. There was syrup, and then what gummies. Thank you, Obi. And what I do also is I take my vitamin C every day. Vitamin C, you can take it in fruit form, like orange, pineapple and all that. But what I do, I take the regular vitamin C. I take 500 milligram of vitamin C. You don't want to take it too much. Vitamin C, will find it too much, you can get kidney stones. So you can take up to 1,000 a day. It depends, but don't do it too much. And I may find vitamin D every day. I take 1,000 IU. I will just share this with you. COVID, I had it. I had it in my household. It is not a good experience. Nyame amboawa ebi nya omunya ne mild ebi susu nya onshohe obi susu nya oyare onya moderate symptoms obi susu nya susu a enye hospital vent or the obeto vent so nyame yawa adum na wo to na upie fi mu a echire ensunsanso so wo ho. Some people had to go to do rehab. Some people had to get their kidney transplant. Some people end up with cardiac issues. It is not pretty. So this is what I do to protect myself. I double up on what I usually take. I double up on my vitamin D to 2,000, or you can go up to 5,000. I double up on my vitamin C, my husband, my family, I double up on the vitamin C to 1,000. I mean, child, we didn't show, any heavy symptoms. Yeah, we had to go to the hospital. This thing is, you may even be walking around, when you be, but you are asymptomatic. So let's try to social distance, and then we take this vitamin, all this, take your vitamin every day, one a day. In gummies form, you'll be good to go. Also, you will test positive, but it can pass by you and then you'll be okay. If you're a healthcare provider, try to begin in that COVID by healthcare provider. Start stripping off from my garage. Me coming them. So say after someone will be a jagun. No one now they will strap straight into your living room. Until if you can start to practice all this a year, okay, fine. There's light at the end of the tunnel. Natural outside, Obi now come myself. Yes, there is a study going on. You must say, yes, steady. And we are doing study on so many different kinds of things. So there is a natural outside nasal spray in clinical trial right now. Oma to these hand sanitizer for the nose. So it's in there. It's in UK4 and in Vancouver company be or more year. And hopefully, if it goes well, it will be a hand sanitizer for the nose and also a boy. And for the meantime, let's try. Help me, I help you. They say nipa baako. Say me virus here. Na me di pia. I can affect. Maybe 20 people in a day. That's how 20 news is going around. Yeah, pay your freedom. Yeah, pay your nije. We want to get on with our life. But how can we get on with our life? We have to do it now. Then we stay away from what, yes, quarantine, and easy, you shut them, we need your socialization. But we want our life back. We have to do it now so that we can get our life back. If we don't, today say my brain, it will keep going this, this route. Now, we can get our life back.
nti saa nso so na saa brain time nso so a ɛsi yɛtumi yɛ afam deɛ ne yɛde boa ɛma yareɛ no ɛkɔ fam anaasɛ yɛtu aseɛ koraa obi draw yɛ na fans a ɛkɔ Facebook ne nyinaa no principal na meka kyerɛw sɛ obiara fans ne dɔɔso ma no na obi ka Hetty ɛka asɛm bi paa na ɛyɛ very very important na ɛyɛ very good ɔsɛ yɛn educate about cloth mask no nso so ɔsɛ obi wɔ ha ɔhyɛ a yɛmma ne hu yɛnka what's a cloth mask no emu ne yɛkyerɛ nya mainly ya ne yɛpɛ anaasɛ ɛsono ha ne sono ha yɛhu sɛ ɔbɛnotu sɛ oh nea mehyɛ design wei ɛwɔ outer enti ebia wokɔ wodeɛ wawie wodeɛ san wo kam anaasɛ wohyɛ no wodeɛ san wo kam anaasɛ anadede wokɔ akɔfa wankɔ akɔdane no ebia na virus no droplet bi wɔ hɔ na wahinheli ɛno ka ho bi na obi wɔ hɔ a na wanya COVID no bisa say how come I got it obedrin was me nko baabia minimum bi onye bi wo madwuma mu onko baabia because over time the mask you are mask or you be all running say ye or in fact or implement precaution papa but so testing positive or devastating and can occurring ka or yanya depression obisa say how did it happen the household nso so obi an testing negative obi an testing positive. It could happen, say, be a mask, and ocean one share, and not in a disposable one, no, we are touching it. And I say a cloth and so see every single day. Now, what send your head to Kayano, young quanqua your mistake, and quanqua daneno, and fight your number. Yam rest, yet no quarry yam your time.
No, I mean, for back so counts our cloth masks, no, so most of the time, no, any inner filter layer. Is any you don't say a regular disposable one no 3 layers. Oh my hand. But cloth mask, if you however cloth mask is just ordinary there's no it's not protecting you that much. And I yes some bishop max yeah what so say what some you transferring it because a show no virus ni wo ma nim. Into the moment that touch, you touch your mouth, your nose, your eye, you can get it. Now with me per se, be a time call, but I think this is more educational.
Yeah,
I had a lot that I was going to talk about, but I mean, it's
okay. You bet me the money.
I just want to say something. Said I have 3 things actually, but I couldn't say. I just want to give some symptoms. Obi who say it's not all symptoms that come with headache and fever. You can get diarrhea. You can get conjunctivitis so I just want to give people some clues. Say, in case you're seeing all of these things, that try to isolate yourself. So even cry from your family. Ubenya diarrhea, ubenya runny nose. Abdominal pain now is some of the symptoms. Abdominal pain, sore throat, which was not even listed before, and a taste and smell. Obi only any pain anywhere, but you can taste, you cannot smell. Once you start seeing that, so we can taste, you can smell. That's something that you have to try to start isolating yourself from your other family members. Conjunctivitis that had just came out when I don't know where so I know when you pink eye, like that. That's one of the things I want to add to it. And one of the things as well, your bad time you look out for something I'm friend COVID toes. I have to mention this because clinic they said there's so many kids coming there with COVID toes, like come with toes now. How it looks is the top, ebe to say the abubo pomponya was that the word pomponya? Then it will start to be black. Now I say a pili. Now Osha it will be like purple, reddish purple it just looked like bibi a childless. Now what they will say now before so share so they no until that so they'll get that no manya akeka no na at the same time it's burning at the same time. This will back complaining say I'm having rash. This symptoms is only for children and little adults like in Kuala up to like 15, 16 years now affect you. And you just watch out for these on your kids. So who say bad complaints and in 9 and Kuala go home, they'll show rash all over their body and as in some. But mostly no, a woman 9 and your nansua is called COVID, right? There's a term given to it as COVID toes. And you just watch out for the kids. And as symptoms started by Kuala, that means the kid had already gone in it. Fight, the body overreact. And that's the sign a bank no. About time was what keep an eye on your kid. Once they start complaining of rash or those symptoms, reddish purple under their toes, as soon as I said it, so tell the doctor or talk to them, because say a drew certain level be not supposed to see fever with that rash now. It's a more serious condition. Treatment in the hospital before it get worse. Until me can't come home. Say a time we need to next time.
Yes. Pacho, baby, Samamia Jewa was saying, please, if you're on BP medication, is it okay to take your vitamins?
Yes, it is okay. The vitamin is just like so you're on BP medication. It's okay to take your vitamins. The only thing that is not okay will be friend me Eka say me cover with me feel say me iron me need iron my hair weak my hair, no. Me got iron, no. Me got extra of weight, no. Extra of no. You take your regular vitamin. If they have your woman, they have one a day, women one a day. Me or my formulating in a way say a year my body no do have 50 plus. A beboa for be already 50, maybe you want the name, but regular vitamin is nothing more than like what you are eating your daily a year already. A daily allowance, the amount the body needs for the day.
Okay. Me pacho, as careful, bet me a contribute to be a kawamai. Me pacho, as careful so. Oh, cast pacho.
SK, you need to unmute yourself.
What?
Hello. Actually, the thing I mean, make can't on and say, as that doctor see, I think one of the things that people don't really know is that because maybe coronavirus, maybe I was admitted in an ICU for 10 days. Now, to be in the ICU and also local hospital, it's easy because they treat you like a disease. That one, I'm going to be very frank about it. The moment you go in, the people that come in there, almost spend 10 minutes. You have a camera in the room. I want to communicate with you from the next station, unless they really have to come and do something in the room. You have no visitors. Until I say, oh, you'll be in fact say, papa paying for you. I won't say that name technology, papa now. We had a video call to a fear to talk to anyone. So basically, you're isolated. It's in a way to me and coming through the area or not. Basically, your end of life and I won't. It's between Dr. Janet and Dr. Ross, if you guys can elaborate on the isolation and it's very scary. So your body they drove on within 10 minutes they want to leave. We're doing an equine the brow and you say the brow inside or basically at your door and then that's it. It's we have to definitely take it very serious.
Yes, so true. It's so true that isolation. But child say no. Who ask you now? It's true. Everything robots they give you medicine through this, they give you that too. That very depressing, and and because of that, it's leading to depression. And then it's so also idea Mesa can't want to say. Obi I say your community, people are stigmatizing that you obi when you're COVID, so outcast. No. So obi COVID that's not the time to shun that person away, because you are pushing the person to to his or her death. And this is the time to, if you cannot go closer to the person, cry out, talk to the person. talk to the person, because at that time now Obia pushing say outcast, Obia shows up about because we are, you know, that's the time the person, because I'm just speaking from experience. When I had it, I will menyari bebro, but the mind, you know, me say, how did I get this? Every corner of my house has hand sanitizer, alcohol, way, me ba, obia befia, me catch my husband, strip yourself over there. You be if you TBC would not see us in our room. So I was just going through that emotion of that, you know, depressing. And at that time, no, luckily for me, I mean, I had people around me that called and, you know, to tell me, you know, it's okay and all that. But I'll just say, it's a time to tell the person that it's okay. It is okay. You can get through this, because the mind itself has effect on our body. Whatever the minds think, it can damage your whole body. Until we yari, now we can say, we catch on, we say, oh, I can survive it. I mean, can't be yeah, I mean, you know, it's unfortunate people go, but the moment you start doubting yourself, oh, me be woo, that will have effect on you, and you can collapse, and maybe you cannot even get up. Doctors are dying, nurses are dying, people are dying alone, going through depression. It be weird, DCU. Sometimes I go there, or COVID people. You can see people like going through, you know, psychological problems, that maybe I'm dying. Nurses will go to them and say, no, honey, you okay? Let's go for a walk. You know, so I'm just telling you, people need people at this time in point. People need people. You know, call them. Maybe the person is down. Maybe the person is sick. So this is the time for healing. So let's heal mentally, so that only physical healing.
Yeah, yes, a psych problem across steady stress, psych problems adults because Yariana Kasasani Obia Kasa is so depressive. You go down. And it's hard when also here say, send your kind, your friend now before you share, even for be or just test or call the person. Maybe say, oh, what is saying na if you hear baby, when you're COVID in be, and I say, oh, here baby. Your time ba nia me person coming we ka ho asem kakra ye foforo na aba no do me kan but as ye brush it to go ye e foforo na aba no ye se no affect nkwala nso pa ye mpanifo ni tifie almost see do no say almost see oh ye see ye ayen so ma yen socialize ye ntena ase ye ntena ye fie omo hye na be ko hwe na kwala akọ meka kwala menka kwala ebia 10 years 12 years so meka yen because say ye maame mote ase a ye yan kwala ma wom na ye mum akwakofa aba omo so na omo immune system wo form so kakra na kuo edien do ya kam mask edien ye beka kire ye mpanifo ene ye nkwala na ye kokochi edi niema ba no ubesha o mask all right ubeba bedu ubeyi wo all right ube wo nsa all right but ebia naka bibi kitwa bi ebia asem kan ye wo fi ama ye men mpanifo no be like stone ye social distance ye ne mpanifo kasa omu kwadware ye mo mu nika kwadware enkonkwadware nwie ansa na ye nsoso akoho ombekwa kitchen na nase bibia ye mo mu ni di nwie ansa na ye soso akwakoye senia enframa ebefa yentem because yare we unim senia eba ana Dr. Fauci kan spread pa and teachers said the least most of transmission no eye kiti obi benya. Dr. Rose me patcho betimi aka bibi aka ho amaye na ya hwete na yen fampon 1 minute okay
Okay. It's a variant. Virus now is mutating and it keeps changing, and then that's the variant. Oh, it's pretty much the same. To say now, I can't be brave, you know. You find say who fi who kwa juma. Oh, because who kwa juma ba you don't know if you got it or not. No, to say now, you try to at least give a little bit. To the immediate family, no sure penny for fear or more underlying disease. Maybe you could be asymptomatic, you'll be fine, but almost the omunya, they might not be able to survive it. The other thing that we can do, thank goodness we have technology this time, right? We can use more of technology. We can FaceTime with family and friends instead of like being that touchy feeling now. You penny and to give that distance, who can And the other thing that we can also do, I see a share. I can't be reassured also but it's not all about a juma. We need to rest. We need to exercise. We need to walk, listen to music, read, go, do things because stress is not good for our body either. Well, we have to really try and do some coping stuff. Dr. Janet, I can't enroll near but we still have to, unwind. Kakra into so like try and get some rest, try and get some exercise, try and unwind, and don't be all over the family into careful penny for penny just be very cautious so bad now wash your just to protect them walk about wouldn't so was a wound so into to be extra cautious about that. Now, or the care and stuff that we've been talking about.
May I add back? Me facho. We are individually try to do some breathing exercise. You kind of like sit down, the BI once or twice a day. You inhale very deeply and then hold your breath and then breathe out, exhale. If you also breathe in a couple of times, now while forced to cough, like you cough out deeply. It's opening up your lungs and helping you, your lungs kind of like work. This now breathing in very deep. There's something wrong. It shouldn't be. Until you just do that. And also most of the time, you try to sleep on your tummy. The bro how die what that prone position like what butu all these little things. Now sister Dr. Ross kind why sisters kakra then hydrate yourself. Hydration is very important this time. Enjoy your tea, limit your sugar intake, but you can also use honey. Tea kakra, honey kakra. All these little things, as I said, eat your food as medicine. Now, and yes, that you will say, women in Rosa, or Gianna, or Bedino. The mom pie and I yen try now, yen decent, using in Yakopon and why and I life back.
Hydration, we here, pa. Na me kind actually article be. Now, Cassa mainly no so I no. So once you no more from one or pressure your blood pressure possible. In time, you may say before the door na pressure was because the door didn't pay you cry. It's a hydration. Ne make us a mere socialization as a me. Yamin chade, your DJ principal when tem. Say Ebia, we shall know why a border. For Prince Paul, Gada, and Crawford Ebia with friends from, and now you be a Zoom party. You be a Zoom wine party and a Zoom cocktail party. We be probably to make a be 60s. You be show your wig, go be on funny wig, Mra. Prince Paul, Beba Shaman, me call Facebook, they comment a Google, DJ Prince Paul, the whole wide world, which is true. On charge, okay, see. Or no credit, I say, would you just talk and not frame me? Now me organize BB Sama money and have a fun. Unye bi da obeka say do do say there's nothing like face to face. COVID ya me say Zoom socialization to say me no ka say I feel like you are here, I'm here with you. We are talking like face to face. Enti yen kosona yen motivating crofone yen encouraging crofone say be party a once a week we can party. As I said, DJ will bash it for us. Na yen fa no so nko yenim. Yen mre na okay, yeah, let me say something na yen fa nko 9:30 prep because say no it's almost 9:20.
So please, I have a question. My lovely
Ladies.
on Zoom, Dr. Rose and Dr. Janet. So, can you guys talk a little bit about the vaccine situation and when it will be possible, how we can get vaccinated, please?
When you can get vaccinated, dear, I know, dear, it will come from, that we cannot tell. But I can tell you the importance of the vaccine. Also, initially, I talked a little bit about how the disease and a virus or bacteria or whatever invade into your body. Now I take you over. Now your white blood cells now you wanna are fighting against that virus. Say bacteria and virus, like I say COVID, the enter body now. Now say white blood cells not ever fighting. Before I talk about the important, I want to tell you how the vaccine works, but I just want to bring this scenario, then you will understand how the vaccine works and you can decide. The vaccine is not compulsory, but it's highly, highly recommended. But it's not, in your force, but it's recommended. It is a bacteria and COVID equal body anymore. Not attack your body, no, not a replicate like a multiplier. The white blood cells not attacking no. White blood cells not are attacking no. So many of them. Obia you need ya oye. So then I'm can no more attacking na. It takes time, days, weeks for them to get rid of that infection. So I'm getting rid of that infection now. Now, that white blood cell no, almost copy. Sa abua na kunu no getting rid no. They copy it. No almost abua no bibia. That is what we call immunity. So almost copy sa abua no. Is there be am above no copy me suban no copy me yi bibia. Now almost stand by. Until next time, that's immunity. Until you are immune, that's why they tell you are immune. You are immune means the white blood cell have copied that invader now above we are copying in nature and copying the BB and or stand by the T lymphocytes, no, and yes, sir. Do they are standby until next time now? That same idea no beba remuno. One nimuno that out until cry wana wa grapple no kuno. So this virus, no, or this vaccine, what it does is it will take time. Now I'm working with that lymphocyte or white blood cells. Now I don't want to go too detailed, just I'm very confused. Now I need white blood cells now here Juma. Now I copy I join it with it, then it will form that immunity, no. Now I am ready. Until that vaccine is going to work with you until the vaccine now white blood cells the fighters the army my alert obiabam then they want to fight the vaccine. They want vaccine be a sanity vaccine be a life. They introduce that life abuano into your system, activate your white blood cells, all your lymphocytes to fight against it. Copy that and stand by. Into your body be they attack it. So that's the nature of this vaccine. They work with your immune system, they stand by. And to COVID need be not attacking. And to getting this vaccine is beneficial. Right away, to say and obi for a BBC question said, "Some call vaccines to say nah, that means me COVID." No, you will get COVID because the vaccine alcohol, it will take time. Even what fresh dose within 1 week, 2 weeks, you can still get COVID, you can still get sick because it will take time. It will take time for the white blood cells and any vaccine to communicate, to copy, and then stand by, so you can get sick. So you get the vaccine. So we have 3 weeks, this is Pfizer, 3 weeks, After 3 weeks, you go and get your second dose. Then 2 weeks after, then you are fully, immunized. It is a COVID, you will get the COVID, but you will not get sick. So you will not get sick. So that's the nature of this vaccine. So it is highly recommended. I heard a lot of myths say being far because DNA. This vaccine had gone through clinical trials, even though it wasn't long enough. They said it was pre-trial before for something else. So people who initiated that out. And it said a dry hospital when COVID at the mouth from Desivir. They already started that process for something else. Into COVID, then they started doing the continuing the clinical trial with that. Who said, ebeboa. Into this vaccine is good. This vaccine, so far, so many people have gotten the first dose. Now the ukowa, the brace ukowa, then I'm yari. Yes, ukowa, ubayari. The first one, you will be okay. The second dose, you get some signs of runny nose, tired. That's a sign that the vaccine is working. That's the sign that your white blood cells and this one, they are, head in head together. Build immunity. Once you are you have that immunity, the virus it will attack it right away, and then you will not get sick. It will not knock you down.
Yeah, that's it. So that's the importance of taking the vaccine.
Yes, all vaccines work equally. When in your life, if you are a live vaccine, they introduce a little bit of that disease and then activate your thing and get, the antibodies get together, they start and then build immunity. And then anytime it will attack it. So this one is kind of like the same way.
Thank you. Dr. Rosubeka Bibi.
Yeah, vaccine, when it comes to the vaccination, I've been vaccinated, both 1 and 2. Pfizer, I got a vaccination. I'm here. But I'm building my immunity. I've got both. I'm looking forward, but I'm still masking up. I'm still doing what I'm supposed to do. There's been a whole lot of, it's a RNA. It's a whole lot. Dr. Jeanette has said a lot, but me can say, when you go to mass.gov, the vaccination, they are in phases. Right now, they're giving the healthcare workers. Like if you work in the hospital or what, they are giving people that care for adult with developmental disabilities. You can say like next week, he's gonna go get his. And look on mass.gov, and they have the stages. It tells you, when it will be available for what group. And then your own physician will also be able to, if you have underlying disease, your term, it's in phases. So when your turn comes through, you'll be able to see where and because I know most of the drug stores like Walgreens and CVS and them are also going to get it. So when it comes to your turn, you'll be able to go and get it. Now, but say that's the other way we can go back to normal. Say it gets to the point if you get access to it, and I can say one more thing because me sure say for vaccination and before vaccination or more day back on the wall no is the same vaccination to when it comes to the time you have the opportunity because there was a program on more cancer people that work in the nursing home almost your moon but imagine say you are taking care of people's the vulnerable population, but because of whatever you've heard, and that's where you must know. It's a risk for all of us. For us, if it's not there, Yemomodenya, Neyankonko, Mawobi. And I know a lot of people are almost so beyond than yeah, idea in society. We are still who we are. Intimacy. You can always look at there's a lot of information around into times.
Obisu
Thank
beside
you.
say unya COVID na utimi wa. Yes. Unya COVID nibia, you can still get it. Omo yes say unya COVID na, you can wait for 90 days. So still now, omo that so studies our virus is still being studied. We don't know how long that immunity lasts. So unya COVID na, but they recommend it say over 90 days. But you can get the vaccine as soon as you are asymptomatic. As soon as I won't show any symptoms, no, you can still get the vaccine. But almost drug is 90 days nearby in such a way, say you are immune for 3 months. So give other people who, you know, chance to get it because who are immunity, you know, for that length of time.
Yeah, that's it. Kwasa your friends almost so Facebook. Nia can was a meaning and almost so I emphasize the importance of it. Obi can say or no. Personally, on recommending me kind Facebook commenting also on recommending cloth mask because no any filters in Dr. Janet can you know it's better say you be use the proper one. And more frankly, now you also can exercise, long reading exercise, you know, that's also some good thing. We said it, yeah, that's be brave. And now Jordan causes to say, oh, yeah, psych hospital, no, say, do not back, mobile for increased depression due to COVID-19. Said the kind of I think, depression, so no, somebody. To makuma so some beka ho asem anyway say betimi aye de aboankofo ene one day kra na your case principal made DJ na ye nyina nsa kra I think say ebeye mo bebre no be so say or no believe healthcare professionals no because they tend to spend their arena crowd do when they come they don't really practice the hand hygiene and personal hygiene instead so may take course and no should be one of them pabwa no dia ba be refie na spread it into we have to be complacent. And Mami Efebia, I'm so can you talk about the vaccine which we did?
Obi bisa or Facebook says or you're pregnant, I'll bet me our vaccine Dr. Janet.
Okay. Dr. Janet Pacho me who no kind Pacho bet me I can so one so say she's pregnant on yum no bet me about vaccine in Biana.
Okay. I had that question at work.
Okay.
So I can say, okay, if you are pregnant, checking your database, you are excluded. But there will call otherwise, unless otherwise, you know, recommend differently from your doctor. But you are excluded from our website up to date. You are excluded if you are pregnant. But what first dose no. Now, actually, who said if you are pregnant after that, now you should still go and get the second dose because you already have the first dose, and then you find out that you are pregnant. It is recommended that you go ahead and get the second dose. Which there's no, even though I'm on study on children, yet still is still going on clinical trial. I'm gonna start initiating that, but the benefit outweigh the risk. You're already getting the first dose. You are partially immune. You want to get a full immunity. So yes, if you are pregnant, after you find out from the first, so when your first dose, and after that you find out you are pregnant, you go ahead and get the second dose. It's fine and it's safe.
You are the 4 year damase. Now what should be a 8 p.m. Fridays be the health talk beba na the akyerɛkyerɛ ho ne de atu ho comment bia na contribution bia even if you want to join us on Zoom kra you can we may let you join us on Zoom muni ho a ye ni wo munti ne wo ho enti ne mbeka bia no ye be try ne de abremu yamre ne ko kayesi upon 9 o'clock but yakọ ye nim kakra. It's make us hear the must be brave. Ye di mo besi say obi ayant me reading the comments bia because of time and I'm an abasa more time ahead. na sani ye kan ye be summarize say COVID-19 no Arabia di ehwamo ye papa asanso so adane ne ho anase new variant aba no so de say ye spread pass anyway the sani COVID-19 spreading and mutating ne one spreading them. Into the patcho, you better say, you better and home so hand hygiene, you're very, very important. You're building your immunity, immune system. Dr. Janet Pranseka say, in your near you didn't that nutrients in free. Young for vitamins, no one can experience say vitamin B. I will say a high amount of vitamin C and I say high amount of property, a building immune system to say elderberry. Into why know what you elderberry or can citrus be brain or can say a kutuno untimini grapefruit what the orange what the lime what the lemon be brain to say opa for vitamin C tablets and I say lozenges or whichever form it is biano na it build the immune system na yen resting more because say you overwhelm my body now and no my immune system echo form very 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 important na yare no so aba no yempanifo no so atifie no ye ne yakwa bonten kokofa beye om se wo nko baabi a Dr. Rose kan se wo nko baabi a tena se enhu hia pa se so kwa na ha wo nko tena se ne save life. President Biden say 100 days challenge mask challenge. It's Dr. Rose can say yamamodi say be implement a mask no. Na yen social distancing or should that demonstrated senior mask no a bishani dia what they are saying no. Ye finimu pa ne mo anefa e ho ene omo quarter of entry omo kokotina mo na omo system no kokko replete kitas na omo akoye land. So very 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 important. Mask no very important. Nye nhu yen say ye. So we share mask na won so ye contaminated same thing because okasa particles no ebi to top baby na so nipa ne wo covid wo de onim say wo mask wa ye obehu an wa kwakofa so wo fa chips na wo de aka wa no chips na de kan ye no wo de bi ko wo enti yes stress ye momodi an say e be implement hand hygiene because the most effective way of preventing diseases and illness ehu hia papa enti ye nkoso aman say mumre bebre next week ye be hia.
If I tell Obi, by popular request or for request, this year best I any deal. It's the way they might do 2 million when him says, yeah.
Patriot, that's it. Me Patriot, next week, no, you bet me at Waso. I don't for that must pass money at Jehon. If you say you're no near corner, yampa, see it's me, ya for mudi, ya parts. Get to a bina, ya bay no, a best saving life. Ama. Abrabono ababeye debut ami ehyiamu enche ye mask ye enche ye makeup ye e ma no ebegina ye ne mu ache e ma ni bi kasa mu makeup be popanti mask no kra ya na ne hye enche no mo hye shield ni mum me pa chaw enframa betimi atwe particles ne bi ntim pa chaw shield no ehu hia pa ba try say o mask no be hye ya summarize be brain ye ntimi anka so the importance of vaccine yaka ho asem say hu hia papa research is so enti se ye ya famu dia enche ye nyina ebedi ye omo ye no sanitizer nitrate oxide nia eja enka kuma yi obika angina ye treat ye say etimi ku covid pa ye guso ye ho ade enche ye be jubilate life like our ye norm ye na mo ye nhye mask enti ye therefore about 9:38 ye dimbesi happy ya da masse more comment more contribution very very important ne mo pese ye polish ho ne mo pese ye de babia no mo drop ye da masse wo more contribution ye da masse nso se mo ya asotie na mo tie efi se mo ni why yes su ni ho principal patro fa nyum ba ko twai mo na ye mpo. Bredel, Mary Glam, and now Mary Bredel. Or no, what chimenim na why miti, what chimiti, I am a kama, Mary Glam, Mary Bredel. So open makeup artista, no frame, and now made the number better now what book. Jewelry in so, ya, New York. Nso so ne to maame na na ya me das bebre ya me shama adofo ya kram wo
na me pa cha wo obi eyi no
na me ya eno hihye aba memrenti
okay. Yeah, that's it. Yeah, send my phone carrier so on the 30th, yeah, baby. Mr. Annabelle, I'm going in 1 week, you know, I was Pentecost, Emmanuel Assembly, I see Honum. And Prince, I know that Mr. Titi Glover has Papa, no, so the dating,
Yeah, Mr. Jerry Glover.
Jerry Glover, I'm dating.
And that one is it's not yet concrete.
No, it's not yet, but it's coming up. Okay. And then I think we have a young girl, so.
Next week, I'll have all that information for you.
Okay, great. All right.
Good night, folks.
Jerusalem,